Good morning, and thank you for joining us as we discuss community-level approaches to advance health equity. I'm Michelle Spencer, Associate Director of the Bloomberg American Health Initiative, and I'm joined this morning by Bloomberg Fellows Erin Franey from the Food as Medicine Collaborative in San Francisco, California, and Victoria Adewumi from the Manchester City Health Department in Manchester, New Hampshire. We're going to jump right in this morning, and I'm going to start with you, Erin. You're working on a unique program called the Food Pharmacy Program. Can you tell us about it and its impact and how it has helped communities?
Yes, thank you so much for having me here this morning. It's truly an honor. The Food Pharmacy Program was designed by the Food as Medicine Collaborative to comprehensively address patient food insecurity, support nutritional behavior change, and advance health equity. So the program is co-locating healthy groceries, cooking, nutrition education resources, connections to other food resources within the clinic setting, and also helping for patients and for clinic staff to really draw that connection between what patients are eating, their diet, and their health outcomes. And so this is really about transforming healthcare for both patients and clinic staff, for healthcare systems to really understand those connections and recognize that clinical care is maybe about 20% of what impacts a person's health. So much of it is these underlying social determinants of health, food being one of them, and that we see this program as a way to take a really important step to helping support patients' health and well-being, especially patients who have faced significant barriers to good health because of ongoing health inequities and health disparities. And I would say a second impact it's had on the communities we work in is, these are clinics that a lot of our patients have been going to their entire lives. They have strong relationships, but there's also a history of distrust and abuse within the healthcare system for communities of color. And so a part of what is also happening here is working to really repair and rebuild trust. And we hear that from patients all the time. And I think that's a huge part of this program.
Yeah, Erin, it sounds like there's the social and medical approaches that you are using to really advance health and reduce those disparities. I wonder, I'm going to shift to you, Victoria. Can you tell us a little bit about the Manchester Community Schools Project and the impact that it has had on communities, particularly adolescents? I understand that the program has had some success with the Robert Wood Johnson Foundation Health Prize. Can you talk a little bit about that?
I would love to. And thank you so much for having me. It's a pleasure to be here with you and Erin. And the Manchester Community School Project, something I'm so professionally and personally proud of. It looks like co-locating resources and services directly in community through schools. So we think of our schools as really neighborhood hubs or hubs of transformation. We know that health happens in community. And so we have, with our incredible network of service providers, co-located everything from fitness classes to financial literacy to parenting classes, food programs. It really runs the gamut of social determinants of health-related programming. And we think of schools as these kind of incredible incubators because they are within walking distance. Folks can easily access them. They feel like familiar environments. Folks often either have a child or at least are somewhat familiar with their neighborhood school. And we're able, with the partnership with community, to really stand up programs that support families, which in turn supports adolescents.
Thanks for that, Victoria. When you talk about the partnerships with the school system, I want to throw it to Erin and ask, why is the intersection between healthcare and food insecurity so important, as we've just heard from Victoria, in terms of the importance of community partnerships?
Yes, I think healthcare has a huge role to play in addressing food insecurity and other social determinants of health. And I hope that's where these systems are moving. And that's in huge part, as we've been discussing, that, a person's diet does have a large impact on their health, and folks who are food insecure, it's associated with worse health outcomes, particularly with a variety of chronic conditions. And so what we are trying to do as the Food as Medicine Collaborative is really bridge these two systems so that healthcare can embrace food insecurity as a health issue and be able to help address patients' needs beyond that kind of more purely medical clinical care.
Well, I thank you both for joining me in conversation. It certainly resonates, the work that you're doing, that these are opportunities to really use local community-based efforts to really advance the health of communities. And I will say, you each mentioned transformation, and I think that your programs are certainly transformative with the role that you're doing and the work that you're certainly doing. And we so much value you and appreciate you for all of your efforts. Thank you for joining us today.